Okay, good afternoon, everyone, or no matter like what time you're watching this. We appreciate you joining us today. I am Representative Dan Miller, and you have tuned in to one of our Disability and Mental Health Summit primers. This one here obviously is on a key topic that we are very excited to talk about, performance-based contracting. This will work here for people as individuals and for families. It's a lot of information, and we thought that this would be a good format for us to talk about it. So we appreciate all of our speakers we're going to get to in just a moment. For those of you who also are interested in our disability and mental health, I'll go over this again at the end, but our Disability and Mental Health Summit is coming up. The big part of it is on May 8th. You could check out disabilitysummit.com right now to see a whole bunch of the programming that we have. This is our 12th annual, so I need another hand. So 12th annual summit. So we're very excited about it. This year we'll be at CCAC. So we're glad. We appreciate them hosting it as well. So we got a great program there. And these primers are always meant to sort of remind people that the summit's coming, that issues are really needing to be discussed. And we do this, of course, before the state budget, which is also coming up in June. So that's the quick rundown. So let's get into our topic today. For those of you who are watching live as well, you should be able to submit a Q&A as you hopefully can click on the button there and just do it. You can also email my team if by some chance we don't get to a question today as well. We will always try to get you an answer afterwards, so don't forget the email is there. And you can access this as well as every one of our programming that we do virtually at repdanmiller.com. So you can always contact us there too. So let's get right into our discussion. And I want to take a moment here to introduce, we have three speakers here to talk about. So I'm going to introduce all three of them first and then get into the program. So bear with us for a moment because we have taken all their accomplishments and we've tried to boil it down to 12 words. No, all right, it's a little bit more than 12 words, but we've tried to make it a little brief synopsis here. So let's see how we did. So first, we'll, at some point, not first, but we'll be hearing from my friend Nancy Murray. Nancy has more than 45 years experience in the disability field. She's currently chair of the Providers Alliance Government Affairs Committee, board chair of the Pennsylvania Assistive Technology Foundation, and board member of the National Task Group on Intellectual Disabilities and Dementia Practices. Nancy and her husband have 3 adult children with intellectual disabilities. She previously worked in leadership positions in the Down Syndrome Center at Children's Hospital, Pittsburgh, the Staunton Clinic, the PA Office of Developmental Programs, and the ARC of Greater Pittsburgh and Achieva. And that's all she's done. But that's a lot. And it's just a little bit of her great accomplishment. So thank you, Nancy, as always. We'll also be hearing from my friend Patrick D'Amico. Patrick has served as the executive director of the Provider Alliance, a Pennsylvania association dedicated exclusively to supporting community services for individuals and families with intellectual disability and autism since 2017. He began his career in the field 40 years ago as a direct support professional and has since held leadership positions in the provider community, consulted for human services organizations, and worked in advocacy and policy development. Patrick completed his undergrad studies at Duquesne, subsequently earned his MBA from the University of Pittsburgh, and is currently, in all of his free time, enrolled in the Duquesne University Klein School of Law, just on the side. So he's doing that as well. So good luck with that, Patrick. We're joined as well by Brenda Bolkowski. I have no idea. Did I say that right, Brenda?
It is right.
No.
It is right.
She said good enough. That's what. Brenda has been director of the Allegheny County DHS Office of Developmental Supports, where she oversees daily operations. Her role includes assurance compliance with the Pennsylvania AE operating agreement, continuing development of best practices as it relates to services for those in need, and maintaining a strong and varied network of programs to meet the needs of individuals registered in ODS. Brenda is an active member of the PA Association of County Administrators, and she serves on the START Advisory Council as well as the Pennsylvania Court Behavioral Health Executive Committee. She received her bachelor's degree in child development from the University of Pittsburgh and her master's in special education, which I appreciate, from Duquesne University as well. Those are our three incredibly well-versed expert presenters who are going to help us understand what we're talking about in relation to performance-based contracting. So I want to thank everybody for joining us. I also want to note from the county, we want to thank County Executive Sarah Honorado for always making her staff available to all of our programming that we do. So we definitely appreciate having the county executive support in these discussions that impact so many. So thank you, Sarah. So that being said, what you guys are going to see, if you are not currently seeing it, I can't tell, is a slide. You can tell how old I am. It's a slideshow, right? But you're going to see a presentation. No, don't laugh at me, Nancy. So you're going to see a presentation that's going to go up here, okay, that we're going to go through slide by slide to talk through what this means. We're going to go through Patrick and then Nance and then Brenda as well. And then we're going to do some Q&A too at the end. So we're going to go through the presentation first and then kind of save some discussion at the for when they're done taking us through the whole thing. So that's how it's going to work. We invite you to stay with us and to participate. And to start us off, the law student extraordinaire, Patrick D'Amico, come on up, brother. Tell us what we're looking at.
Hi, Representative Miller. Thank you very much for the warm welcome, nice introduction, most especially for doing the summit here for now 12 years running. So very much appreciate the opportunity to be here today and speak with all you folks about performance-based contracting. So this is something that's relatively new, just to sort of set the foundation in the current budgetary environment, beginning with the federal government. These services are funded largely through Medicaid. So we want to sort of establish that background and foundation. So a lot of these services are subject to, and the state receives literally more than half the funding to provide community services in Pennsylvania, currently from federal matching dollars from the federal government under Medicaid. So couple the issues around workforce, which have been a longstanding problem in our community services to be able to find enough qualified direct support professionals. There are a lot of complicating factors, and ultimately that leads to a waiting list in Pennsylvania for services. So there are still over 12,000 total people on the waiting list. There are almost 8,000 adults on the waiting list and almost 4,000 adults who are on the emergency waiting list. And that is something that Governor Shapiro has dedicated an initiative to eliminate the emergency waiting list for adults. However, you can hear we have a long way to go on all of that. So challenges to improving quality, as the slide indicates. One of the things that's happened, and again, to sort of set some foundation, what we're going to talk about today is performance-based contracting that only affects residential services. So the services that are administered in Pennsylvania, the money that comes from the federal government, the state appropriates through the budget process. It goes to the Department of Human Services, and then the Office of Developmental Programs in the Department of Human Services distributes these funds to provider organizations, directly to individuals, families, many, many different services that folks receive through ODP services funded by state and federal government. So when we look at the management tools that providers need to use, there are about 400, a little bit more than 400, but we'll say 400 for the sake of today's discussion, residential providers. And those residential providers serve probably what we would say the most complex cases, people who need to be supervised for the most part 24 hours a day. So performance-based contracting is really just affecting that particular group of providers. Overall, there are well over 1,000 providers. So not everybody provides residential services, but the performance-based contracting that we're here to talk about today is exclusively for residential services. So when we talk about management tools, we are talking about 400 organizations that are in a Medicaid-funded program, and with that funding comes a lot of compliance requirements. So in order to meet the grade, licensing standards, federal standards, bill in a certain way, have service documentation, meet criteria for the types of services and the frequency that those services need to be provided, and meet every component of what becomes an individual's service plan. So there is a lot of oversight, a lot of regulation, a lot of provider requirements. So one of the things and one of the drivers behind instituting performance-based contracting did indeed come from a recognition that the state and its oversight of these programs wants to upgrade management tools. The next sort of bullet their life course in complex systems, we're serving folks in many cases throughout their lifetime. Changing needs of people is something that has to be addressed. Some long-term care services and systems really are just looking at serving people, say, at the end of life or during a crisis. But we're looking at the entire lifespan of individuals, and it's challenging to take care of folks with a workforce that largely has been underfunded in terms of where they are situated in the market. So that is another one of the identifying drivers that when the state looked at making some improvements, what would we need to do? Payment structure not aligned with outcomes. So the payment structure in Pennsylvania has evolved over many years, but it's only been since the year 2018 that residential services went to what many of you may hear or know of as a fee schedule. So previously, there was what was known as cost-based funding. And if you go back many, many years, the counties really got a lot of funding. And the approach was much more tailored in terms of individual organizations, the types of folks that they served. So I think the counties had a little bit more flexibility. Once you move to a fee schedule reimbursement system, it's really difficult to tailor needs to individuals. So the payment structure, almost by design, would not really align closely with what an individual needs for their particular life and types of services and supports that they need to thrive in the community. So as a result of all this, the term poorly performing providers kind of came out of documentation and just underperforming in terms of the standard. So when we talk about performance-based contracting, it literally required a new what is called waiver for the state to enter into, so that these types of services can be provided in the community versus in an institutional setting, which historically where they were provided. The state has to sort of ask permission to do this. So the performance-based contracting waiver is really a selective contracting waiver technically. So before, and what kind of drove the numbers towards so many providers, the state standard was really every willing and qualified provider could become a provider. So when we have 1,000 total and 400 individual residential providers, there's a certain standard that, of course, all of us want to see be met. We want to see quality provided across all the programs. So this was one of the things that ODP identified in indicating why they wanted to move to a performance-based contracting system. And when we talk about the last item, increasing acuity of assessed needs, it's really just a way of saying people with the most complex needs oftentimes need more services. And when you need more services, the cost is higher for that individual. So even though I've mentioned there's a fee schedule, there are some acuity-based indicators. So in residential, for instance, there are needs levels, and this all gets converted into some increased dollars based on assessments. But we know over time, as we all age, we all need care at some point, and this is just another driver on the cost of the system. So all of these factors are really the changes that were contemplated to improve quality and the basis on which the state moved forward with performance-based contracting. So if we can go to the next slide, I want to just give a few of the high-level details about what performance-based contracting is. And my colleague Brenda will go into some of the details around this, but I'm just going to at a high level kind of talk about what this means. So the contracting, because every service provider has a contract with the state, and the specific quality standards and performance measures are changing for providers. So providers have had to work with the state and basically comply and submit data on about 80 new performance measures. Now, some of these are measuring the same thing as before, but in many cases, there's been a guideline or a benchmark established that going forward, providers have to do some new and different things. And then to align the payment with outcomes, one of the elements that the state is introducing is what we're going to refer to today as tiers. So there will be payment tiers within residential providers based upon the competency that they can demonstrate in certain areas. And because this is new, it's really not as though the state can look at the provider system and say, well, we absolutely know who those providers are. So a lot of this is self-reporting. Some of it is providers doing attestations that they will be able to indeed meet these criteria going forward. But the state will be very deliberate about making sure that providers, in order to qualify for the increased tier levels, will in fact meet this on on a data and a measurement basis going forward. So there's some data collection, and I'm sure we'll get into that discussion here at some point during today's presentation. So going forward, right now, as I've mentioned, residential services are the only services that performance-based contracting actually affects. But this year and very soon, the state will be rolling out performance-based contracting standards for supports coordination. And supports coordination affects every service for a person who's in the waiver through a supports coordinator. So there are changes coming there as well. And the state identified similar reasons for why they wanted to see a change in contracting and a change in performance and outcomes with regard to supports coordination. So I think we can go to next slide, please. And this is, of course, just picking up the timeline this year. So there's just really a couple of things that we've noted on the slide in terms of what's really happening in this year. A lot of activity was foundational, and a lot of things going back to 2023 when concept was first introduced. There were work groups and stakeholder groups from across the system and within government that really looked at how to build the performance measures. What would the tier levels look like? So a variety of things have been going on for a long time. So when we pick this up in this particular year, there's really a lot of work that's already gone into this. So January 1, 2025, residential rehabilitation, licensed and unlicensed, life sharing, licensed and unlicensed, and supported living. So when I talk about residential services, those are the specific service descriptions. So residential can mean any of those things that are above the January 1st date. January 1st, 2026 is when supports coordination goes into place. So this year will be the year, similar to what happened with residential services, where it's being built, it will go out for public comment once there's a document that people can look at. And I'm sure there will be at least one round, if not more, of public comment that then informs the final document and moves supports coordination into a similar model where it will move from basically a fee-for-service system. 15-minute units is what I understand, mostly predominates how supports coordination is funded. So an intended movement away from that and a movement toward making sure that services are delivered in a high-quality way. So with that, I want to turn this over to my colleague, Brenda, who's going to get into a little more of the details on the tier assignments.
Thank you, Patrick. Good afternoon, everyone. As Patrick mentioned, there's a lot of activity right now around residential providers submitting their applications to be assigned to one of these following tiers: conditional, primary, select, or clinically enhanced. And we'll get into each one of those as we move along. Next slide. So the tiers are based on the standards, some of the standards that you see before you on this slide, right? We want to measure how are providers hiring, training, and retaining their staff. As I'm sure a number of you have experienced, staff turnover and retention is very problematic in our system. We are competing for staff with other human service systems, and it's hard work. It is very, very hard work. So it's very difficult to keep a stable workforce. We want to measure how providers are using technology to support safety and independence. We have a number of providers who are looking at remote supports and technology to help individuals maintain their independence in their own home through different sensors, different mechanisms that, again, can be reminders for an individual or help them contact staff when needed. We also want to see how agencies are responding to promoting independence, competitive employment, and community integration. Here, again, we have a lot of people in our system who may be in a group community setting that maybe want to live on their own or a little bit more independently. And what kind of processes and assessments are they putting in place to help an individual accomplish that when that's something that they want to achieve? We definitely need providers who can support people with complex needs. Over the years, we've seen a significant increase in individuals with not only intellectual disability and autism, but physical complexities, mental health concerns, and even some substance abuse issues. Again, really requiring our direct care staff to be at the ready to respond to any and all of these complexities when meeting someone's need. And then finally, we want to see how data is used to improve the quality of services, tracking everything from incident reports to an individual's opportunities in the community. How does all that come together to really promote the stability and the strength of that agency? All in all, these fall into 4 basic categories around sustainability, workforce, clinical capacity, and access. So even how we look in the future at admissions and discharges from provider agencies, that is not going to be permitted to move as quickly. So more of an investment in how people get transitioned into community settings, and more support while in that setting and becoming acclimated to that agency setting. Next slide. So as we think through all of that, and we look at the tiers that have been developed, the first being conditional, this will be the tier that agencies are put into if they're already in a provisional status or have a revoked license. They will be given a time period to come out of conditional. I believe that time period has been set at about 18 months. And again, we at the Office of Developmental Supports will be part of any technical assistance and remediation that we can help this agency, again, come out of conditional status. Next slide. The primary tier will likely be for a number of our agencies. They meet the current standards that have been set by the state, a few additional standards that have been set. They're a solid agency, they do good work, and they'll be ready to move forward serving individuals with no interruption. Next slide. A provider that wants to be assigned to the select tier. This is where we see this expansion into these areas. They need to deliver at least 2 of the 3 residential services in the performance-based contracting model. So we have supported living, life sharing, and community group home. So they'll need to provide at least 2 of those 3 and meet additional established measures. So the measures we talked about earlier, there's a baseline and there is some enhancement to those that these providers would also have to meet. Next slide. And then the clinically enhanced providers, the providers that meet this tier, they really need to have on hand medical or behavioral supports to, again, they're aiming to meet the complex needs of some of those individuals I mentioned earlier that beyond their intellectual disability and autism have physical, psychiatric, substance abuse, and other conditions that require really a higher level of specialty care. So they need to meet, again, those baseline requirements and then several additional requirements, including certification of staff in these medical or behavioral support rather, components. Next slide. Yes. So I think I'm going to hand this over to Nancy because I think, again, I've thrown a lot of information at you and a lot of different tiers, but what it means to a family, an individual, I will leave to Nancy to explain. So thank you. Take it away, Nancy.
Thanks, Brenda. And thank you, everyone, for joining us today. You know, as a family member myself, some of these performance areas are very, very important. And it's because of families having conversations with Deputy Secretary Kristen Ahrens and other people at ODP that some of these performance standards are now part of performance-based contracting. So one of the areas that providers are now going to be expected to meet is what we're calling family engagement. So as you see on the screen, providers are now going to have to demonstrate engagement of and support to families, which is going to include, appropriate, adequate, regular communication and relationship building with families. And, why is this important? Well, I'm sure families can answer that question, because we need ways to communicate. We need good relationships with the providers that are caring for our loved ones. And I think it's been proven that when provider organizations do have good relationships, good ways of communicating with families, that there are better outcomes for the individuals receiving these services. Next slide. Another performance area is under the title of referral and discharge. I've been in many meetings over the years, some of with the Office of Developmental Programs, in creating this performance area. And they listened to families who did not have very good experiences, either at the time of finding a provider or when their loved one was being summarily discharged from services. So going forward, providers are going to be required to track how people are referred to them and what decisions are being made upon discharge of someone. And when it comes to the referral, ensuring that they deliver services to someone within an average of 90 days or so, once that referral to a community home has been made. So no longer will providers have, 6-9 months to begin to providing services for people. We need to be more efficient. Once a person, a family has decided that a provider was chosen to provide services, for those services to begin. And then on the other end, for discharges, again, providers are now going to be required to report to counties, to the Office of Developmental Programs, why a person is not going to be returning to their home. And this could be, after a serious inpatient, medical situation. Maybe the person was in skilled nursing or a rehab facility. It could be someone is now being released from jail. And the provider is now going to have to be able to explain to ODP and the county, what sort of planning, what sort of coordination has the provider, looked into what kind of accommodations could be made for the person to return to their home. And then if not, to be able to have a frank conversation with the county and ODP about, what were the barriers for that provider to have that person return to their home. And again, why is this important? Well, because historically, individuals and families have had to wait very long periods of time for services to either begin or for decisions to be made about if and when a person could return to their home. Next slide, please. DSP credentialing. So first of all, DSP stands for Direct Support Professional, and they are the staff who provide day in and day out support for people who are, living with supported living or with a life sharing provider or living in a community home. And there is a huge push and emphasis throughout the IDA community right now on helping our staff to become credentialed through a national credentialing system to help them to increase their knowledge, their skills, the values embedded in things such as everyday lives. Because the more that our staff have increased skill sets, have more knowledge, and are more competent. They feel that their skills are more valued. That just goes into higher outcomes for the people that they're supporting. So again, why is this important? Just as I just said, this all is going to lead to better outcomes. It's also going to lead to higher wages for the direct support professionals who are credentialed. And it's not just the direct support professionals, but also the frontline supervisors. Providers are being asked to establish what we call career ladders, so that for DSPs who want to move up to become supervisors, there's a ladder. And they will have access to training to help them to become supervisors. This will also help organizations to retain their staff, because DSPs are going to know that the more education, the more that they're credentialed, they will have the ability to move up in an organization. And the other thing, frankly, is as DSPs, either want or need to maybe move to a different county, another part of the state, they can now take their credentials with them when they change employers. And that's very important, because at least we're keeping highly competent DSPs within the system. Next slide, please. So let's get to the real question of today's session. What does it all mean for individuals and families? Next slide. So in the beginning, in the next couple of months, as as the entire system really moves more toward performance-based contracting, services, that we see for our loved ones are not going to look that much different. But over time, the goal and the thought is that people's access to residential services will improve, that provider organizations are going to be able to increase capacity, they're going to be able to take more people off the waiting list, and they're going to be able to make more investments in the services that they offer. Over time also, as we just mentioned, we're going to see our DSPs, our frontline supervisors, become, much more knowledgeable. Their skill sets are going to be expanded, and the quality of the services that they provide are going to be enhanced. And then last but not least, individuals and families are going to have access to more information when selecting providers. Before this year is out, individuals and families are going to be able to go to the ODP website, and we're going to be able to see for all of the providers who are, credentialed at that point, if they fall into one of the tiers that Brenda spoke about. We're going to be able to look to see whether a provider, either the provider that's supporting our loved ones or a provider that we may be more interested in at the time, which tier are they in? Are they in primary? Are they in select? Are they in clinically enhanced? Right now, individuals and families really don't have this kind of information. By year's end, we will. Next slide, please. So what's changing? This is a quick slide. Here we go. Well, as I just said, individuals and families are going to have access to more information to assist with selecting providers. There are going to be families. In fact, I've had conversations with a few already who are not pleased with the providers that their loved ones have today. Well, when a family down the road feels that way, they're going to be able to go to a portal on the ODP website, and they're going to have a lot more information to be able to look to see if maybe there's another provider out there who may be better able, better equipped, better schooled to care for their loved ones. As Patrick mentioned before, payments to providers are going to be really more based on the quality of the services, the outcomes that they are demonstrating. It's not that, everybody providing residential HAB is going to be paid the same amount anymore. Providers who are really invested in doing a better job, who are providing quality services, they're going to be paid for those extra efforts. And then last but not least, ODP is going to be much better able to provide oversight to make sure providers are meeting those high quality standards. And, frankly, if a provider is still in the conditional tier, they may not be a provider in Pennsylvania much longer, because there's going to be much more oversight and much more effort to be sure that the providers that are part of our system are providing the highest quality services possible. Next slide. Let's talk a minute about what's not changing. ODP is going to continue to operate the waivers just as they are today. That is not going to change. The other thing is the existing county administrative entities, such as Brenda's, is also going to continue all of the current waiver functions that are the responsibility of our counties and administrative entities. Nothing is going to change, either for ODP or the administrative entities. And this third bullet point is very important. All current residential providers, everybody providing services today, will have the opportunity to continue providing those services. Now, they're going to have to meet the new standards, but when this is fully in effect, all current residential providers will have the opportunity to continue providing their services. And what has been a major question from families is this: individuals will continue to receive the residential providers from the providers they choose. So if you're pleased with the services your loved one is receiving, your loved one is going to stay with that provider. For families, as I said before, where maybe they're not so pleased with some services, they are now going to have the opportunity to have access to a lot more information to maybe make a change in providers. Next slide. And Brenda, I think I'm going to turn it back to you now.
Okay. Thanks, Nancy. So what is pay for performance? Next slide. As I shared with you some of the criteria for tier assignments, and as Nancy has shared with you, some of those quality indicators we'll be looking for. Providers, except those on the conditional tier, will also be eligible to receive additional payment that we're going to call pay for performance for when they actually move on and accomplish transitioning individuals from residential habilitation to life sharing or supported living, that lesser, if you will, restrictive environment or lesser need for staff oversight. When providers actually put into place a firm adoption of technology and remote support, that will be rewarded with additional payment. Transitioning folks under their service to competitive integrated employment as the individual wishes. And then that credentialing of direct service professionals and supervisors that Nancy also mentioned. This additional pay will really help strengthen, to Nancy's point, really help strengthen an agency's ability to, again, stabilize that workforce and provide their staff with opportunity to move within the agency or across the state, but overall strengthening the provider network. Next slide. And I think I'm handing it back to Patrick for timelines and next steps.
Thank you, Brenda. So the timeline, you've heard a lot today and gotten a lot of information. So before I really speak to the timeline slide, I'll just say as far as next steps, based on everything you've heard today, I think the most important next step is really education, adoption of this new system, making sure that you, if you're a family member in this audience today, as well as individuals being served by this system and providers, really understand this system so we could work to make it better so that it really just isn't some new overlay by our government to say we're going to do things a little bit differently and change the compliance standards. So that's really one of the most important things. And one point that I want to emphasize, because we've talked a lot about reimbursement and the tier levels, that an increased tier level does not necessarily equal a better provider. We need to have premier providers in every tier. And when we talked about acuity, as we have a few times today, not everybody will need a clinically enhanced provider or a select provider, but we want all providers to elevate their performance. And in fact, the standards really do create new requirements for all tiers in the new system. So as far as the timeline goes, you can see we're really only looking out a couple of months. Providers submitted their information for their tier assignment between February 15th and March 15th. ODP is now grading out those assessment tools. And the timeline indicates, and ODP's promise to us is that they will start the tier assignment process in May, and the tier assignments will become effective July of 2025. So that means the information that Nancy talked about as far as publication, we would expect sometime between May and July, hopefully before July, assignments will be not just made, but made public. And then this will be an ongoing process going forward of data collection, tier assignments. And again, there will be a lengthy process of really making sure that this continues to grow and evolve and actually improve services down the road, and really realign resources so that they go where needed most, so we can continue to deal with our workforce issues, our advocacy around waiting lists, and continue to make sure that everybody who needs and deserves services in our system in Pennsylvania is able to receive them. So with that, I think we are going to turn it back to Representative Miller.
You know, you'd think I would know to click the button, but very good. Look, I'll tell you guys, to be honest, that was a lot of information in a short period of time. So I want to appreciate that. Everybody, I actually was taking notes as we went too, so I hope everybody else found that to be helpful. We do have a question here too. I want to be sure to see that everything gets answered the best we can. When does a provider need to officially begin tracking referrals? Did we answer that yet, guys? Patrick, any idea?
Tracking referrals in terms of intake, probably. Brenda, do you want to weigh in on that as far as requirements of the state?
I would imagine that's going to start as soon as the provider gets, no, I take that back. I think there's going to be a 6-month primer opportunity for providers to get their data management in order. So there will be some time between tier assignment and the official beginning of tracking.
Yeah, I saw something that talked about when providers were going to be notified of tier assignments in May.
Mm-hmm.
Once that notification is done of the tier assignments, who do families or individuals get notified of what the provider's tier assignment is, or does that matter to them?
I'll jump in first, Brendan, and say my understanding, because there have been assignments made. There was an earlier round last fall, October 15th to November 15th, when this was all just pretty much rolled out, and nobody actually qualified. So through some advocacy, the state agreed that they would take the submissions of those providers and they would just update the data. So the last year's submissions were actually based on 2024 data, or the 2023 data, I'm sorry. So then when 2024 calendar year was over, this new period was looking at a new year of data for a lot of the metrics. So what ODP did was they just took that 2024 year and they applied that to those applications. So what happened in that instance was that 5 of those providers who were previously denied a tier assignment actually received a tier assignment. So my understanding is those providers were notified directly, but those providers have not been posted anywhere. There's not any public-facing information document website that says those providers have been approved, but they know who they are. To the extent they want to share that with their families, Representative Miller, I believe they have the right to do that, but I'll defer the rest of this answer to Brenda.
Yeah, it's my understanding that once everybody is assigned a tier, it will be public information somehow, but it's not my understanding that families will get any direct notification of tier assignment.
I think that ODP will alert families as to how they can obtain the information regarding the tier of, the provider providing their services for their loved one. I would think that providers, however, would send some sort of notification out to families because remember, one of the performance standards is good communication with families. So maybe their first good communication can actually be reaching out to the families and letting them know what tier they're in.
How similar is this model to surrounding states?
Yeah, my understanding is this is somewhat cutting edge.
Yeah.
My understanding is that the state is being looked at and watched very closely. Now, that's not to say I'm sure there are some similarities. I would just speak to we belong to a national association anchor along with some of our colleagues in the association world. And PAR and RCPA and TPA were asked as one of 3 items this past year to sort of update on what's going on in Pennsylvania with performance-based contracting, because people across Anchor, that represents all 50 states, were interested in seeing what was happening here. So Brenda, you probably want to speak to maybe the deputy and some of the things that you might be aware of as well, but that is my take from the provider perspective side.
Yeah, no, I think from an AE and county perspective as well, every meeting we've been in with ODP, deputy secretaries talks about how this is something slightly different and new that they're committed to.
How is family feedback and input used for quality ratings of residential providers?
I would probably speak to maybe what's called, I'm sorry if I get this wrong, Nancy or Brenda, but just the IM4Q, and there's an independent monitoring for quality process, which I believe is what that stands for, if I got it right. There's surveys that really involve satisfaction. I think almost completely involve satisfaction, which would be pretty much geared at the level of the person receiving the service. Yeah. So that's not necessarily family, but to the extent and degree that includes some family input. Brenda or Nancy, perhaps maybe you want to weigh in on that, or maybe there's other elements. But I would also add stakeholder input was also something in terms of building some of this that was inclusive of family members in that perspective. And there are other groups that really kind of represent that family perspective as stakeholder groups that I know that the department listens to.
Yeah, I'm hoping that, individual and family satisfaction now goes beyond just IM4Q. A lot of people opt out of IM4Q. We've had it around now for decades. It's, kind of old in some people's minds. I'm hoping that ODP either puts out different surveys that they want providers to use, or providers create really good surveys that really do measure the satisfaction of individuals and families.
And I will say at the beginning of these conversations, in terms of looking at options that ultimately resulted in this, there was a strategic work group that was well represented with families. But Nancy, to your point earlier, it really is family experience that carries the most weight. And it really is what agencies, they need to rely on their reputation, right? And so family input, whether it's gathered formally or informally, it is going to impact on the quality rating that a provider may be experiencing. If not tier assignment, some other outcome.
What should families or individuals look for as the greatest challenge to them with the adoption of this model?
I don't see any negative outcomes for individuals and families. I mean, if this is rolled out like ODP is planning, it's going to give individuals and families more access to information. It's going to really almost force providers to take a look at their services and engage more with individuals and families, to pay more attention to credentialing their staff, to look at the services they're providing and can they provide their services in a higher quality way. And I think it's also going to show, I mean, Pennsylvania has hundreds of providers that every day are doing a great job. Even with our workforce crisis, they are doing a great job every day of supporting their staff, training their staff, caring for people. And as Patrick said before, we in the IDA community right now are supporting people with some of the highest acuity needs that we've ever seen historically. As Brenda said, we have people coming out of jails and prisons. We have people who need 24/7 care. We have some people who constantly have 2 staff with them 24 hours a day because of their needs. Providers are doing their best to meet all of those, stressors in a way. So we're very fortunate to have the providers that we do. And I think through performance-based contracting, those that are doing just an amazing job are going to be rewarded more in the future than they are right now.
All right. Thank you for that Q&A. I think we kind of got the list of questions that I'm aware of. So as we pause just for anything remainder, just additional thoughts, plus or minus, right off the top. Patrick, give me your general feel for this. Good, bad, up or down? What's your thought?
Well, we've had, almost a couple of years now, I will say. So I think initial thought, I'm going to kind of capture reaction. I thought this was extremely well received by families, individuals, sort of like I'll call the end users, the people that rely on these services, that see that there is a problem with the provider system. When you look at, coupled with workforce, the high turnover rates, the workforce capacity issues, services dwindling down, families not able to access services. So I think initially, from the family and individual perspective, any intended improvement of that was very well received, because it was a recognition, we have to do something better. We can't continue to go on with 12,000 people on a waiting list. People get a waiver, meaning they're authorized for their services, and then they still can't get services because there's not enough staff to work with them. So then I think the next phase was really, what are we building? And all the stakeholder input that Brenda was talking about. So committees got together. I think right now we're in a phase of just grappling with all of the new requirements from the provider perspective. It's a big workload, not just to submit, but you have to do a lot to be able to check a particular box, yes or no, or you have to meet a very high criteria in terms of how you deal with your incident management. As an example, when somebody has an accident or an injury and you file a report and you have to close that report out and do an investigation, all the criteria were new. So when the state originally said 90% or better on a particular criteria, nobody knew, that wasn't a measurement before. So there's a big adaptation. Providers are adapting to the rules almost as they're learning the rules. I'll say this, however, I feel everybody is stepping up. I know we at the Provider Alliance, this is real, this is happening. Please learn everything you can about it. We try to deliver as much information to our members, recognizing our members are supporting individuals and families. So we have a lot of individuals and families who subscribe to our mailing list. We encourage that. We think it's a good way to get education across the board. And we encourage the same with our direct support professionals, because at the end of the day, they are the people who are delivering this service to families and individuals. So I think it's kind of still a learning curve. I think it's thumbs up positive from the standpoint, people see its progress, but there is some pain. people are concerned about, nothing went away. So I think that's one of the things we are trying to look at. What maybe do we not need to impose on services, the provider community, so we can lighten the load maybe in another area and just focus on this that is directed at quality.
Thank you. Brenda, any thoughts as to that?
Just as the providers have a pretty heavy lift in front of them, I guess I share concern, but optimism as to how the rest of us need to change in order to support that lift. So it really is going to be a shift at my office and how we do business to learn the new expectations, but more importantly, support them in a practical way. Things aren't going to happen overnight. And yet the expectation is that things move along swiftly and consistently. So I think we will ultimately be successful. I think all of this makes sense. It's just going to take a bit of time for it to lift. And I am optimistic that we will be in a much better place a year, 18 months from now than we are now.
Okay, well, I hope so in a lot of ways. Negative outcomes may be associated with supports coordination, performance-based contracting measures as caseloads are expected to rise. When will families have a session about supports coordination? So any thoughts on that one?
Well, I think we're still waiting to see the performance standards for supports coordination. They're due out sometime this month. As Patrick said, then we'll be able to comment on them. But at this point, we haven't seen the performance standards for support coordination units.
I think there should be, however, Brenda, you may know already, if there would be plans to hold sessions. There's generally listening sessions when a document like that is released, so people can submit written comments, and ODP will generally convene meetings for all the stakeholder groups to hear from them directly.
Yeah, that's pretty standard process for ODP. And Representative Miller, I can make sure that you personally get that announcement as we all get it, so you can share.
Well, I appreciate that. That sounds good. All right, we are coming up to the end here. Just wanted to pause. So as I sort of wrap this up too, I want to say, obviously, thank you first to everybody who's joined us online. Shows a big interest, and I hope we're going to see more of that as we get to our Disability Mental Health Summit. Don't forget, there is a school-only event on April 24th in South Hills. May 8th is the general program, all at CCAC. Tons of continuing education credits. It's every reason somebody wants to be there. And May 9th is, right now, it is just seeming to be the another resource fair, this one in conjunction with PPS. Now, keep in mind, all these options are there for you at disabilitysummit.com. So please go check it out. It'll also show you can register. I do want to let people know that we're already moving some of the sessions until a waiting list. Funny enough, but a waiting list, a reality for some of these sessions. So if you do plan on going to the Disability and Mental Health Summit, you may want to double check it now. Okay. All right. I do not see something else that's coming up. Look, big stuff that's coming right around the corner in reality. I mean, you can't get too much closer than where we are. So I appreciate the timeliness of this discussion. I also noted how much of it was funded by Medicaid. I think Patrick may have talked about that at the beginning. I definitely hope Medicaid is still around. So I think that there is a challenge here to which the state will not be able to backfill a program like Medicaid in what it is supposed to be and what it represents. But we'll see about that. Either way, this is an interesting and important document. I want to thank you for sharing it and creating it for me. So I learned a lot going over it. I'm sure some of my colleagues who will watch this as well will too. So again, not seeing anything further. First, to all of our presenters, Patrick, Nancy, and of course, the way that we have to do it, I always have to give a shout out, Brenda, just to the Allegheny County Human Services as a whole, but to my friend Sarah and Murata for making everybody available. So I'm always excited. So thank you for that. but Brenda did a great job as well. Look, this will be rebroadcast. You're going to find it available at refdanmiller.com with the slides, whatever we're calling this, right there as well. So that will be available for people too. We'll promote it when it's up there, so you'll get a notification about the link. You could sign up for these notifications and anything else that we're working on at refdanmiller.com. And finally, do not forget that the largest collection of disability and mental health resources and all that encompasses is always our summit, to which we are very proud to work with so many great organizations and nonprofits and people to make it a big program. I know, again, we're having sessions that are going to be bumped up on closure, and I know that the resource fair on May 8th is like 135 or something like this. Then there's another one on May 9th where we're teaming up with the Special Olympics and PPS, a special program. You can check that out. And then again, April 24th is our South Hills transition fair for kids with an IEP or 504 plan, age 14 and up. Okay, so that's what's on the horizon. Patrick, Nancy, Brenda, thank you. Patrick, Nancy, I think you guys came up with this idea, so I could see why you wanted to do it. It's very interesting for those with even just a little bit of an idea. I definitely learned a lot, so thank you for doing it and recommending it, okay? And for everybody else, go ahead, Patrick.
Thank you very much, Rep Miller.
Oh, you were thanking me? Is that?
Yes.
Yeah, anytime
Thank
want.
you and everybody. Yes.
Well, thank you. Well, what about me?
Yes, I started with you, actually. Sorry.
Well,
Sorry.
you started.
I'll thank you again.
He's a good guy, right? So listen, thank you everybody for joining us. Look for more information, disabilitysummit.com. There's always work to do. The budget's coming up in June. You care about disability mental health services, make sure your voice is heard. You care about Medicaid funding being available for these and other important life-sustaining issues, and rate increases, things getting indexed to inflation, people moving off a waiting list to real programs that are available for them, competitive employment. You care about these things. Get your voice involved and let's go make a difference. We appreciate all of you. We'll catch you next time.